Hello, I'm Justin Gallagher, Associate Publisher of the American Journal of Managed Care.
And I'm Sarah Stewart.
Welcome to This Week in Managed Care from the Managed Markets News Network. In the wake of last week's Supreme Court decision in King v. Burwell, opponents of the Affordable Care Act are still reeling from the ruling in favor of the government and have turned their attention to the 2016 presidential election as a way to repeal Obamacare. While many GOP presidential candidate hopefuls have not outlined exactly how they plan to do so, they have all promised to repeal and replace the law in the next term if elected.
Ovik Roy of the Manhattan Institute says that any repeal attempts must now be done carefully, although it is still possible to do so.
My view is that 2012 was the election that really determined the fate of Obamacare, in the sense that once you have tens of millions of people enrolled in ACA-sponsored plans, you do have to take into account their situation in terms of what you change about the law. And I think any viable Republican approach to an alternative to the ACA has to do that. If you just repeal Obamacare for everybody and throw those 20 million people into chaos and with uncertainty as to what they would actually get, I think that's highly problematic. I think you actually really do have to ensure that whatever alternative you have manages the transition for those individuals in a very carefully and well-crafted way. But that isn't to say that you can't still make significant changes to the law.
CMS Open Payments data is now available for 2014 and details information on more than 11 million financial transactions, totaling around $6.5 billion from drug and device makers to healthcare providers. While the American Medical Association applauded efforts for more transparency, the AMA expressed concerns that physicians did not independently validate the majority of information released from the report. The association believes that the process is too complicated for physicians who might seek to correct any inaccuracies.
Medicaid policies for reimbursement of the anti-hepatitis medication sofosbuvir have shown to differ across disciplines. In a study published in the Annals of Internal Medicine, Medicaid coverage for the drug has varying criteria that does not conform to the standards set by professional infectious disease organizations. Of the 42 states examined, 75% limited access to patients with advanced fibrosis, and many of the restrictions observed in each state violate federal law. Matt Sallow, with the National Association of Medicaid Directors, explained that the high cost of Sovaldi and the large number of potential patients is forcing Medicaid to come up with new ways to handle drug costs.
This really represents kind of a unique blend of both very, very expensive for the cost of the drug itself, but also in terms of the number of people who could potentially benefit from it. Again, great from a public health perspective, but when you multiply large unit cost times a very large number of people, this drug alone has the potential of doubling Medicaid's pharmacy spend.
For the Managed Markets News Network, I'm Justin Gallagher.
And I'm Sarah Stewart.
Thanks for joining us.